Did you know that before 1963, nearly every child on Earth caught measles? The disease killed millions annually until a brave 13-year-old boy and two determined scientists created a turning point in medical history. What happened to this young hero after his blood sample revolutionized medicine? And why has his name been largely forgotten despite saving more lives than almost any other figure in modern history? The long and deadly history of measles as the screen fades in from a dark background to a soft glow of candlelight flickering over an ancient manuscript. The faint scratching of a quill against parchment is heard as an unseen hand records observations of a mysterious illness. As we slowly zooms in on the aged pages, revealing descriptions of a disease that has haunted humanity for centuries. As we look upon this scenery, we realize that measles is far more than just a childhood disease. It is a relentless and ancient virus that has plagued humanity for over 1,500 years. For much of recorded history, outbreaks of this deadly illness have altered the course of civilizations, contributing to the collapse of empires, devastating entire continents, and claiming the lives of millions. The virus responsible for measles, morbillivirus, is believed to have evolved from rinderpest, a disease that once afflicted cattle. The transition from animal to human host likely occurred around 500 BC, coinciding with the rise of densely populated cities in the Middle East, India, and China. But measles wasn't just another disease. It was among the most contagious viruses known to man. Infections spread rapidly through coughs, sneezes, and even the air, making it nearly impossible to contain. Entire communities could be wiped out within weeks. The first documented cases, tracing measles through history. Ancient China and Rome, early signs of a killer virus. Let us cut to a dimly lit Chinese scroll, where an ancient physician records symptoms of a mysterious outbreak in 300 BC. Historical texts from ancient China describe a disease that fits the profile of measles, fever, a spreading rash, and death in severe cases. Though medical knowledge was limited, these early accounts suggested a connection between exposure and immunity, a concept that would take over 2,000 years to fully understand. Meanwhile, across the world, the Roman Empire, 27 BC for 76 AD, was experiencing a similar unknown illness. Roman medical texts mention a highly contagious disease that caused fever, cough, and a rash covering the body. One of the most devastating early pandemics, the Antonine Plague, 165 to 180 AD, is suspected by some historians to have included measles. This deadly outbreak, which also included smallpox, tore through Rome's military and urban centers, killing an estimated 5 million people and weakening the empire's ability to defend its borders. The 9th century, the first scientific description of measles. As we look into a 9th century Persian library, we see a scholar, Abu Bakr Muhammad ibn Zakaria al-Razi, better known as Rhazes, is seen studying patients suffering from what he calls hasba. Rhazes, a renowned Persian physician, provided the first scientific description of measles in the 9th century BC. His work, later translated into Latin, became the foundation of early medical knowledge in both the Islamic world and medieval Europe. He carefully observed the differences between smallpox and measles, stating, "Measles is more to be dreaded than smallpox." Despite these early studies, no cure or prevention existed. The disease remained unstoppable, sweeping through populations without warning. Measles in the age of exploration, a silent weapon of colonization. With this 16th century painting of Spanish ships arriving in the Americas, indigenous people gather along the shore, unaware of the invisible threat carried by the newcomers. By the 1500s, European explorers unknowingly carried measles across the globe, introducing it to populations that had never encountered the virus before. 1519, Spanish conquistador Hernán Cortés arrives in Mexico, bringing measles along with him. The Aztec Empire, already weakened by war, is devastated as half of its population perishes from foreign diseases, including measles. 1630s. Measles sweeps through New England and the Great Lakes region, decimating indigenous tribes such as the Pequot and Narragansett. 1772. Captain James Cook brings measles to the Pacific Islands, leading to catastrophic outbreaks in Tahiti, Hawaii, and Fiji. For indigenous populations, measles was a death sentence. Lacking any natural immunity, entire communities perished in waves of infection. The Industrial Revolution and the 19th century, measles becomes a global epidemic. In the crowded streets of industrial cities in the 1800s, factory workers, children, and families huddle together in unsanitary slums. Smoke from industrial chimneys fills the air. The Industrial Revolution brought people closer together than ever before, but it also provided the perfect breeding ground for measles. By 1846, a Danish physician, Peter Ludwig Panum, studied a measles outbreak in the Faroe Islands and made a groundbreaking discovery. People who had survived measles never got sick from it again. In 1875, an epidemic hit Fiji, killing 40,000 people, nearly one-third of the island's entire population. By 1900, measles had become a leading cause of childhood mortality, especially in overcrowded cities. The 20th century, measles becomes a scientific challenge. The early 1900s, the hospital wards were filled with children suffering from measles. By the early 20th century, measles was recognized as one of the deadliest diseases for children. While doctors could identify the virus, they had no treatment, only quarantine, bed rest, and hope. In 1912, the United States officially began tracking measles cases. Between 1912 and 1922, an estimated 6,000 Americans die from measles every year. Nearly every child contracted the virus before adulthood. By the 1940s, researchers understood that measles was caused by a virus, not bacteria, an important discovery, since antibiotics could not treat it. But no vaccine or cure existed yet. Then, in 1954, as yet another measles outbreak swept through Boston, Massachusetts, two scientists set out to change history. The turning point: Enders and Peebles take action. In a snow-covered streets of Boston, inside a bustling hospital, two scientists, John F. Enders and Dr. Thomas C. Peebles, examined blood samples from sick children. John F. Enders, known as the father of modern vaccines, had already helped develop the polio vaccine. Alongside his determined colleague, Dr. Thomas C. Peebles, Enders sought to isolate the measles virus, a crucial first step toward a vaccine. The key breakthrough: David Edmonston's blood sample. In a hospital bed where a 13-year-old boy, David Edmonston, lies weak from fever, a doctor extracts a vial of his blood. From David's blood sample, Peebles successfully isolated the measles virus for the first time in history. This was the breakthrough the world had been waiting for. What followed was one of the greatest achievements in medical history: the creation of the measles vaccine. Our eyes lingers on a single vial of blood being placed into a storage unit. Our screen darkens, and you can hear a single heartbeat echoes in the background. From an outbreak in a Boston school to the beginning of a global medical revolution, the battle against measles had entered its final phase. Science changes the world, but only when we fight for it. The laughter of children echoes through playgrounds. Families gather around television sets, mesmerized by the latest broadcasts. Students file into classrooms, their days filled with lessons and curiosity. It is the 1950s, a time of post-war optimism, technological advancements, and rapid medical progress. But beneath this image of prosperity, an invisible threat spreads through communities, a disease so common that nearly every child in the country will face it. Measles, known by many names: rubeola, the Red Death, the 7-day rash. This disease is as relentless as it is contagious. It does not discriminate. Rich or poor, urban or rural, it moves swiftly, infecting millions each year. The virus strikes suddenly, first appearing as nothing more than a fever, a cough, a runny nose. Parents assume it's just another cold. But within days, the telltale red rash emerges, creeping across the body. In severe cases, the virus progresses, attacking the lungs, the brain, and the immune system itself. By 1954, measles is not just a childhood illness, it is an unavoidable reality. Each year, nearly 4 million cases are reported in the United States alone. The vast majority recover, but for thousands of families, the outcome is far more tragic. 1 out of every 1,000 children with measles will develop encephalitis, an inflammation of the brain that can lead to seizures, permanent disabilities, or death. 1 in 20 will develop pneumonia, the leading cause of measles-related fatalities. 1 to 3 children in every 1,000 will not survive. Hospitals struggle to keep up with the waves of infected children. There is no vaccine, no cure, no medical solution beyond bed rest, hydration, and hope. For parents, measles is a terrifying yet expected part of raising a child. For doctors, it is a battle they are powerless to win. But for two men, that was about to change. The visionaries, John F. Enders and Thomas C. Peebles. Dr. John F. Enders was no stranger to scientific breakthroughs. A virologist with an unparalleled passion for discovery, he had already left his mark on medical history. Just a few years earlier, his groundbreaking research in cultivating the polio virus in laboratory conditions paved the way for the first polio vaccine, a development that would go on to save millions of lives. But Enders wasn't done yet. He saw measles for what it truly was, not an inevitability, but a problem that could be solved. In 1954, he was joined by Dr. Thomas C. Peebles, a young and ambitious researcher eager to prove that science could overcome even the most persistent of diseases. Together, they set out on a daring mission to isolate the measles virus itself and develop a way to stop it at its source. Their plan was simple in theory, yet daunting in practice. They needed to find a living sample of the virus, strong enough to study, but weak enough to be manipulated into a vaccine. And that meant heading straight into the heart of the outbreak. The epidemic in Boston, 1954. Boston, Massachusetts, a city facing yet another relentless measles outbreak. Schools were overrun with sick children. Teachers reported entire classrooms coughing through lessons. The virus had spread unchecked, infecting thousands. Dr. Peebles went directly into infected schools, armed with medical kits and determination. His goal was to collect blood and throat samples from sick children, hoping that within those samples lay the key to isolating the virus. It was a painstaking and risky process. Measles was known to be highly contagious, and there was no guarantee of success. Peebles needed a sample strong enough to survive outside the human body, something that had never been done before with this virus. Then came David Edmonston, a 13-year-old boy, one of many struck down by the outbreak. His fever was high. The red rash covered his body. He was one of thousands, but for Enders and Peebles, he would become the turning point in their fight against measles. From David's blood, they successfully isolated the measles virus, a feat that had never been accomplished before. They had found their sample. The challenge, turning a killer into a cure. But isolating the virus was only the first step. Enders and Peebles now had to weaken it, to turn an aggressive, highly contagious disease into something that could train the immune system without causing harm. This process, known as virus attenuation, was no easy feat. The measles virus could only survive within living cells, making it incredibly difficult to manipulate. For years, Enders and his team worked to grow the virus in lab conditions, carefully altering it until it was weak enough to use in a vaccine. It had to be strong enough to trigger immunity, but not so strong that it would cause illness. Failures were frequent, but they refused to give up. After countless experiments, adjustments, and refinements, they finally had a breakthrough. The measles virus had been successfully weakened, enough to be used as a vaccine without causing the disease itself. The next step was proving it worked. Trials and triumph. In 1958, the first human trials of the measles vaccine began. Children were given the newly developed vaccine under careful observation. Would it be safe? Would it provide immunity? Would it change history? The results were astonishing. The vaccine triggered a powerful immune response, strong enough to protect against measles without causing illness. It was effective. It was safe. It was a success. By 1963, after rigorous testing, the first licensed measles vaccine was released to the public. In the years that followed, measles cases plummeted. Countries around the world adopted vaccination programs, and what was once an unavoidable disease became entirely preventable. By 2000, measles was declared eliminated in the United States, thanks to widespread vaccination efforts. Why it matters? The fight against measles was more than just a medical breakthrough. It was a testament to the power of science, perseverance, and the belief that no disease is unbeatable. But the battle isn't over. Despite the success of the vaccine, measles has made a comeback in some regions due to vaccine hesitancy and misinformation. Outbreaks continue to occur, reminding us of a time when measles was a daily threat to children everywhere. The lesson is clear. Science changes the world, but only when we fight for it. Dr. Enders, Dr. Peebles, and a 13-year-old boy named David Edmonston helped save millions of lives. They proved that no disease is beyond our reach. And their story is one we must never forget. This is the story of the measles vaccine. The measles vaccine represents a monumental achievement in public health, stemming from decades of research and collaboration. This second part of this narrative explores the comprehensive journey of the measles vaccine, beginning with the identification of the virus, through its development and clinical trials, to its global distribution and the ongoing challenges faced in vaccination efforts. By examining the key figures, scientific breakthroughs, and historical context, we can appreciate the significance of the measles vaccine in combating infectious diseases. The context of measles, a historical overview. Measles is a contagious viral disease caused by the measles virus, a member of the Paramyxoviridae family. Before the introduction of the vaccine, measles was a common childhood illness worldwide, with outbreaks leading to significant morbidity and mortality. Pre-vaccine era. Measles has been documented for centuries, but its impact became more pronounced in the 20th century. In the United States, prior to the vaccine's introduction, measles infected approximately 3 to 4 million people annually, resulting in thousands of hospitalizations and hundreds of deaths. Complications from measles included pneumonia, encephalitis, inflammation of the brain, and subacute sclerosing panencephalitis, SSB, a rare but fatal degenerative neurological condition that can occur years after infection. Public health concerns. The burden of measles was particularly heavy in young children, with over 90% of infections occurring in children under 5 years old. The disease was not only a health concern, but also a significant strain on healthcare systems, particularly in areas with limited access to medical care. The scientific foundations, discovering the measles virus. The journey toward the measles vaccine began in the mid-20th century when researchers started to isolate and understand the measles virus. Virology advances. In 1954, Dr. John Enders, a prominent American virologist, and his colleagues were able to grow the measles virus in tissue culture. This scientific breakthrough opened the door to the development of a vaccine, as it allowed researchers to study the virus in detail and explore the potential for creating a live attenuated vaccine. Key figures. Dr. John Enders, known as the father of modern vaccines. Enders had previously been awarded the Nobel Prize for his work on the poliovirus. His expertise and dedication to virology laid the groundwork for many vaccines, including measles. Dr. Samuel Katz, a close collaborator of Enders, Katz played a pivotal role in the development of the measles vaccine. He contributed significantly to the clinical trials and public health campaigns that followed. Vaccine development, the path to clinical trials. With the virus isolated, researchers began developing a vaccine using a live attenuated strain. This method involves weakening the virus so that it cannot cause disease but still elicits an immune response. Development of the vaccine. The first measles vaccine was developed in 1963. It used a strain of the virus isolated by Dr. Enders and his team. This vaccine was tested for safety and efficacy in children, with the aim of generating immunity without causing the disease itself. Initial trials. Phase 1. The first clinical trials began in 1963, involving a small group of children. Initial results were promising, showing that the vaccine could elicit a strong immune response with minimal side effects. Phase 2. In 1965, expanded trials included thousands of children across various demographics. The results indicated an efficacy rate of over 90%, with few adverse reactions reported. Phase 3. Large-scale trials followed, incorporating diverse populations to assess safety and effectiveness. Researchers monitored participants closely for any adverse events, which were rare. Regulatory approval. After demonstrating safety and efficacy through rigorous trials, the measles vaccine received approval from the U.S. Food and Drug Administration, FDA, in 1968. This landmark decision marked the beginning of a new era in public health. The launch of vaccination campaigns. With the vaccine approved, public health officials launched extensive vaccination campaigns to ensure widespread immunization. Public health education campaigns were designed to educate parents about the importance of vaccination, emphasizing the dangers of measles and the benefits of the vaccine. This included distributing informational pamphlets, conducting community outreach, and leveraging media channels. Access and availability. Efforts were made to ensure the vaccine was accessible, particularly in underserved communities. Public health clinics, schools, and community centers became vaccination hubs, providing easy access to the vaccine. For families, school mandates. Many states implemented school vaccination requirements, mandating that children receive the measles vaccine before enrollment. This policy significantly increased vaccination rates, as schools became a focal point for immunization efforts. By the late 1970s, vaccination rates reached approximately 90% in many areas, effectively reducing the incidence of measles. Global impact. The vaccine's reach beyond borders. The success of the measles vaccine was not confined to the United States. Global health organizations recognized the potential of the vaccine to combat measles in developing countries, where the disease posed a significant threat to children. Global health initiatives. The World Health Organization, WHO, launched the Expanded Program on Immunization, EPI, in 1974, aiming to provide universal access to vaccines for preventable diseases, including measles. This initiative marked a significant step in global health, as it sought to reduce child mortality rates worldwide. International collaboration. Countries around the world began to adopt vaccination programs, supported by international organizations such as UNICEF, which provided funding and resources for vaccine distribution. Collaborative efforts focused on training healthcare workers in administering vaccines and educating communities about their importance. Measles elimination goals. By the late 20th century, many countries had declared ambitious goals for measles elimination. The WHO set a target to reduce measles mortality by 95% globally by 2015. These efforts included targeted vaccination campaigns during outbreaks and routine immunization. Successes of the measles vaccine. The introduction of the measles vaccine has had profound effects on public health, with substantial declines in measles cases and related deaths. Reduction in measles incidence. In the years following the vaccine's introduction, measles cases dropped dramatically. In the United States, reported cases fell from hundreds of thousands per year to a mere few hundred by the early 2000s. Globally, it is estimated that the vaccine prevented 21 million deaths between 2000 and 2017. Herd immunity. The concept of herd immunity became crucial in preventing outbreaks. When a sufficient percentage of the population is vaccinated, the spread of the virus is significantly reduced, protecting those who cannot be vaccinated due to medical reasons. The herd immunity threshold for measles is around 95%, which underscores the importance of widespread vaccination. Long-term health outcomes. The reduction in measles cases has led to improved health outcomes for children. Fewer hospitalizations and complications have translated to better overall child health, reduced healthcare costs, and less strain on healthcare systems. Ongoing challenges. Vaccine hesitancy and outbreaks. Despite the successes of the measles vaccine, challenges persist, particularly related to vaccine hesitancy and misinformation. 1. Vaccine hesitancy. Misinformation regarding vaccines gained traction in the late 1990s when a now discredited study falsely linked the MMR, measles, mumps, rubella, vaccine to autism. This led to increased vaccine hesitancy among parents, resulting in declining vaccination rates in some communities. Research indicates that vaccine hesitancy can stem from various factors, including mistrust in pharmaceutical companies, fear of side effects, and cultural beliefs. Addressing these concerns is critical to improving vaccination rates. 2. Resurgence of measles. The decline in vaccination rates has led to outbreaks of measles in several regions. High-profile outbreaks in the United States and other countries have illustrated how quickly the virus can spread in under-immunized communities. In 2019, the U.S. experienced its highest number of measles cases in nearly 2 decades, with over 1,200 reported cases, primarily among unvaccinated individuals. This resurgence prompted public health officials to intensify vaccination efforts, and combat misinformation. 3. Public health response. In response to outbreaks, public health agencies implemented targeted vaccination campaigns, often focusing on communities with low vaccination rates. These campaigns included outreach efforts to educate parents about the benefits of vaccination and the dangers of measles. Social media has also played a role in spreading both information and misinformation. Public health officials have utilized digital platforms to counteract false narratives and promote accurate information about vaccines. The role of technology and research in vaccine development. The evolution of vaccine technology continues to shape the future of measles vaccination and broader infectious disease prevention. 1. Advancements in vaccine technology. New technologies, such as mRNA vaccines, have gained attention in the context of COVID-19. While the measles vaccine is a live attenuated vaccine, ongoing research into new methods may improve vaccine efficacy and accessibility. Researchers are exploring combination vaccines that can protect against multiple diseases with fewer doses, making it easier to increase vaccination rates. Such innovations could streamline immunization schedules and reduce the burden on healthcare systems. 2. Enhanced surveillance systems. Technology has also improved the ability to monitor vaccination rates and detect outbreaks. Advanced data analytics and reporting systems enable public health officials to identify areas with low immunization coverage quickly. This information allows for targeted interventions to increase vaccination rates and reduce the risk of outbreaks. 3. Research and development. Ongoing research is vital for understanding the long-term effects of vaccination, the dynamics of the measles virus, and the development of improved vaccines. Studies continue to assess the safety and efficacy of the existing measles vaccine, as well as the impact of vaccination on community health outcomes. The importance of global collaboration. The fight against measles is a global endeavor, requiring collaboration among governments, health organizations, and communities. 1. International partnerships. Organizations such as the WHO, UNICEF, and the Global Vaccine Action Plan, GVAP, work together to promote vaccination efforts worldwide. These partnerships facilitate the sharing of resources, knowledge, and best practices to combat measles effectively. Global health initiatives, such as the Measles and Rubella Initiative, aim to eliminate measles and rubella worldwide by increasing vaccination coverage and addressing barriers to immunization. 2. Equity in vaccination. Ensuring equitable access to the measles vaccine is critical, particularly in low-income countries where healthcare resources are limited. Vaccination campaigns must consider the unique challenges faced by these populations, including geographic barriers, cultural beliefs, and socioeconomic factors. Efforts to increase vaccine access include mobile vaccination clinics, community health worker training, and collaboration with local organizations to build trust within communities. 3. Capacity building. Building capacity within healthcare systems is essential for sustaining vaccination efforts. Training healthcare providers on the importance of vaccination, effective communication strategies, and proper administration techniques ensures that communities receive quality care and information. The future of measles vaccination. As we look to the future, the lessons learned from the measles vaccine experience can guide public health strategies for other infectious diseases. 1. Strengthening immunization programs. Strengthening routine immunization programs is vital for preventing outbreaks of measles and other vaccine-preventable diseases. This includes maintaining high vaccination coverage, ensuring access to vaccines, and addressing vaccine hesitancy through education and outreach. Incorporating vaccination into primary healthcare services can help streamline immunization efforts and improve overall health outcomes. 2. Addressing vaccine misinformation. Combating misinformation about vaccines remains a significant challenge. Public health campaigns must focus on promoting accurate information and addressing common misconceptions. Engaging trusted voices within communities, such as healthcare providers and community leaders, can help disseminate credible information. Social media platforms can also play a role in spreading accurate information. Collaborating with tech companies to promote vaccine education and counteract misinformation can enhance public understanding and acceptance of vaccines. 3. Global health initiatives. Continued investment in global health initiatives is essential for achieving measles elimination goals. The WHO's goals for measles elimination by 2020 and beyond require sustained commitment from all countries, with a focus on increasing vaccination rates and addressing barriers to immunization. Regular assessments of vaccination coverage and outbreak responses will be crucial in adapting strategies and ensuring that no child is left unprotected. Conclusion: a legacy of hope and responsibility. The story of the measles vaccine is one of remarkable scientific achievement, public health collaboration, and the ongoing commitment to protecting children from preventable diseases. While significant progress has been made in reducing measles incidence and mortality, the journey is far from over. The resurgence of measles in some regions serves as a stark reminder of the importance of maintaining high vaccination rates and addressing vaccine hesitancy. The legacy of the measles vaccine is not only about the disease it prevents, but also about the collective responsibility we share in safeguarding public health. As we reflect on the past successes and challenges, it is crucial to recognize that the fight against measles is part of a broader public health narrative. By committing to education, community engagement, and global collaboration, we can continue to build on the successes of the measles vaccine and work toward a future where preventable diseases no longer pose a threat to our children and communities. Call to action. Ensuring a healthy future for children worldwide requires a concerted effort from all sectors of society. Here are some actionable steps that individuals, communities, and policymakers can take. 1. Advocate for vaccination. Encourage friends, family, and community members to vaccinate their children. Share accurate information about the safety and efficacy of vaccines and address concerns with empathy and understanding. 2. Support public health initiatives. Participate in public health initiatives that promote vaccination. This can include volunteering at vaccination clinics, supporting local health departments, or participating in community education campaigns that aim to raise awareness about the importance of immunization. 3. Engage with healthcare providers. Foster open communication with healthcare providers. Parents should feel empowered to ask questions and discuss any concerns regarding vaccines. Healthcare professionals can provide valuable information and reassurance about the benefits and safety of vaccinations. 4. Utilize social media responsibly. Use social media platforms to spread accurate information about vaccines and combat misinformation. Sharing credible sources, such as public health organizations and research studies, can help inform others and encourage vaccine acceptance. 5. Advocate for policy changes. Support policies that enhance access to vaccines and promote public health. This can include advocating for school vaccination requirements, funding for immunization programs, and initiatives that address vaccine hesitancy in communities. 6. Educate yourself and others. Stay informed about vaccines, their development, and their impact on public health. Understanding the science behind vaccines can help individuals make informed decisions and advocate effectively for immunization. 7. Support global vaccination efforts. Consider supporting international organizations that work to improve vaccination coverage in low-income countries. Donations to organizations like UNICEF, the WHO, or the Global Fund for Vaccine Alliance can help ensure that vaccines reach children in underserved areas. 8. Promote research and innovation. Encourage and support research efforts that aim to develop new vaccines, improve existing ones, and address public health challenges. Innovations in vaccine technology can lead to more effective and accessible immunization options for all. Final thoughts. The journey of the measles vaccine is a testament to human ingenuity, resilience, and the capacity for collective action in the face of public health challenges. It serves as a model for how science, collaboration, and community engagement can lead to significant improvements in health outcomes. As we move forward, the lessons learned from the measles vaccine experience can inform our approach to other health issues, including emerging infectious diseases and vaccine-preventable illnesses. By fostering a culture of vaccination, advocating for equitable access to healthcare, and addressing misinformation, we can create a healthier and safer world for generations to come. In closing, the story of the measles vaccine is far from complete. It continues to evolve as we confront new challenges and opportunities in public health. Together, We can honor the legacy of the measles vaccine by committing to a future where every child is protected from preventable diseases and where the lessons of the past inform our actions for a healthier tomorrow. References for further reading. To deepen your understanding of the measles vaccine and public health, consider exploring the following resources. 1. World Health Organization, WHO Measles Vaccination Resources. 2. Centers for Disease Control and Prevention, CDC Measles Information. 3. National Institutes of Health, NIH Vaccines and Immunization Research. 4. American Academy of Pediatrics, AAP Vaccines and Your Child. By taking these steps and engaging with the resources available, we can contribute to a stronger public health landscape and ensure that the legacy of the measles vaccine continues to be one of hope and progress. If you enjoyed this video, please like, comment, and subscribe to CyberTheo.